Breast cancer is a disease that can be due to either inherited tendencies or can be due to other effects that we call sporadic, and these would be mistakes in DNA division that can arise for a variety of reasons. The importance in understanding the ones that may be familial, which is unclear at this point, it's somewhere between 10 and maybe 25% of breast cancers are felt to be familial. It's important because that means that the tendency runs in the family and it can be inherited. There are certain clues that can help us identify people who are likely to have these inherited mutations, but none of these tools are perfect. The ones that we tend to use in clinical practice are people who develop breast cancer at a young age, patients who have multiple cancers, such as breast and ovarian cancers, patients that have bilateral cancers, either at the same time or years apart, and then patients with a strong family history of either breast cancer or ovarian cancer. In particular, those that have a family history of breast cancer at a young age. So there's a variety of indices that we use to identify those that may require testing. And because these are inherited mutations, the testing is in the blood because it's in every cell in the body. So a blood test can then detect whether or not one carries an inherited mutation. Now, there are several different genes that can be mutated that can lead to a susceptibility to breast cancer, and some of these mutations also lead to susceptibility to other cancers. The most common of these is BRCA1 and 2 that gives you a susceptibility to both breast and ovarian cancer, as well as other cancers. For example, BRCA2 can increase the risk of pancreatic cancer. So being one of the more common ones, this is one that we have tested over the years, ever since the late 90s when this testing has been available. There are other genes that can confer susceptibility, some to breast cancer, others to a variety of cancers. For example, Lynch's syndrome we see in people that have colorectal or uterine cancer. It also gives a risk of breast cancer. For patients that are very young, for example, under the age of 35, we're concerned about a much less common mutation called P53, also known as the Lee-Frommani syndrome. And this can give not only breast cancer, but also brain tumors, sarcomas, leukemias, and they tend to affect patients at even younger ages, such as in their teens and 20s. When we identify someone who may have a strong family history, we recommend that they first have genetic counseling, either by a physician or by a qualified genetic counselor, to review the whole concept of inherited malignancies, inherited mutations, and what the implications of testing are. Because if we detect a mutation, that means that the patient is at risk for breast cancer. If they already have breast cancer, it may impact on their therapy. And also, it calls for the need for testing and counseling of other family members. All direct blood family members, such as brothers, sisters, mothers, and fathers and children, have a 50-50 chance of carrying the same mutation. So the implications for developing cancer and for appropriate screening are important as well.